Kia ora, good evening. Newshub can reveal thousands of high-salaried public servants have been given pay rises, even though there is supposed to be a government pay freeze on them. For 2 years now, public servants earning more than $100,000 have been subject to a restriction preventing pay rises, except in exceptional circumstances. But official figures obtained by Newshub reveal more than 2,500 of those higher paid workers have been granted pay rises, all of which has left one health worker struggling with the cost of living increases to tell our political editor she doesn't think she has ever felt so undervalued. Jenna Lynch has this exclusive report.
Janet's been working round the clock as a contact tracer.
2 years of us working 7-day weeks.
A crucial part of our COVID response, and the thanks she got for keeping us safe.
So I got an MTA voucher, $20 and a cookie.
Surely a pay rise too, right?
I wish. No.
No, Janet's one of the 400,000 strong public service who've had their pay effectively frozen since 2020, a government belt-tightening exercise in light of the COVID crisis. She's one of our allied health workers taking industrial action because the government won't come to the table with a decent offer.
Our wages aren't keeping up with inflation, so our power's gone up, our petrol's gone up, our grocery bill, so it's really difficult.
And while Janet and her colleagues have been in bargaining, the government's broken its pay freeze for thousands of the public service's top earners. While the pay freeze was effectively in place for anyone earning over $60,000, the strictest freeze was for high earners. For those earning over $100,000, pay rises were outright banned. The official pay guidance stating there are to be no increases to bands, no pay adjustments for those paid over $100,000. But in exceptional circumstances, they could get permission from the Public Service Commission.
We did expect and do still expect a period of restraint there. There will be exceptions to that.
Well, turns out there were a lot of exceptional circumstances. Of the 18,301 staff in the public service who earned more than $100,000 last year, at least 2,670 got a pay rise. That's about 15% of higher earners.
That bracket, we're doing very, very well every year. The fact that it's down to 15% is a significant reduction on what it was before.
When the government says it's doing a pay freeze, there's literally thousands of exceptions. It's just not fair for people struggling with a cost of living crisis.
And there's one agency that's really been making it rain. Kāinga Ora gave pay rises to 1,048 of its staff earning over $100,000 in 2021. That makes up about 45% of its entire workforce. The rationale, they hadn't had a pay rise in 2 to 3 years, and no staff earning more than $200,000 got a pay rise. But neither's Janet.
I don't think I've ever felt really so undervalued.
Not how we want our health workforce to feel right now. Jenna Lynch, Newshub.